Hi, we're back. World Health News Today. Thanks for sticking around. I'm joined by Dr. Jeff Schweitzer, and we're talking about climate change and the effect that it has on our health. Thanks for sticking around with us.
I'm delighted to be here.
There was one or two things that you mentioned before we went to break that really caught my attention. I'm sure many people in our audience, too. You mentioned there's all new kinds of insects that we're having to deal with that we didn't have to deal with before. Right. And you mentioned rodents, and of course the first thing I said to you, well, there's been rats in New York City for eons, but you mentioned to me during the break that we're talking about different kinds of mosquitoes, different kinds of rodents. Can you elaborate on that?
Yeah, absolutely. I mean, in mosquitoes, for example, the mosquito that carries malaria is Anopheles, which is a different species than we commonly have in our backyard. Okay. And that's the mosquito that's marching north. Rodents, rats really, funny enough, rats are not necessarily the problem. Although, if you live in New York, I'm sure you're not happy about the rat infestation. But let me give you an example of how climate change affects biology, which affects human disease. And there's this white-footed mouse in the four-corner region of the United States. And because of extended drought there, which we believe is partly related to climate change, there has been a sharp decrease in the predators of these white-footed mice. What's happened is their population's exploded, and it turns out that there is a critical density in which they start harboring and transmitting hantavirus. Okay. And so there was this very mysterious outbreak of hantavirus, which no one had ever heard of before. And people were scratching their heads, why now? And it turns out if you really go back and look at the biology, you can really trace it back to climate variation. Whether you want to talk about climate change or not, but certainly local climate variation had a direct impact on the transmission of diseases to humans from these mice. We don't really quite know how to deal with it on such a short-term basis, but we're seeing and hearing reports of, just dramatic things that are facing us in the next 5, 10, 15, 20 years, which is, just a head on the pin for the amount of time that the Earth has been around. You really hit on the critical issue. We are dumping 6 billion tons of CO2 into the atmosphere every year, and we're experimenting with our own environment. We don't know what the consequences of that are going to be, and you just hit on the most important point. The Earth is in balance, and that balance can be upset. In fact, we've seen it over geographic time. Not all the things that imbalance the Earth are anthropogenic. There are natural causes. Most scientists believe that right now the climate is changing because of man-made activities. What happens is we are conducting an experiment with a very finely tuned, balanced instrument, and we don't really know, we can't know what the consequences are going to be because of those very complex interactions with all these different systems and balances. That's the big unknown.
Well, why do you suppose that the microorganisms and the bad insects, the bad rodents, so to speak, are able to adapt so quickly, and yet we're not? I mean, is this an adaptability issue?
In part, but the other part of the equation is that we are creating an environment that they like now.
I see.
They don't even have to adapt to new environment. Okay. But that brings up yet another point, and that is the emergence of new diseases. What's happening is, as some of these insect vectors move north, they are in viruses and bacteria, they are finding that as they move into new territories, they are adapting to a slightly different environment, and they're emerging as new diseases. For example, coming back to West Nile, there was a new variety that was found in 2002. It has subsequently infected 175,000 people. And that's a new disease. And that's a new disease as a result of what you just talked about, basically the adaptation of an existing organism to a new environment. And that's another of those unintended consequences that you also mentioned.
We're going to take another break. We'll be right back. This is fascinating. Please don't go away. We're back. Thanks for staying with us. World Health News Today. I'm Don Balarjian. We're, of course, talking to Jeff Schweitzer. Fascinating discussion about climate change and talking about factors of climate change you probably haven't been exposed to before. Again, thanks for staying with us through the break.
My pleasure.
We started on this topic before having to go to break, but I was, mainly concerned with, we talked about many years ago when they built the Panama Canal, and they brought a bunch of workers from the northern hemisphere, and very many of them died from malaria. They weren't accustomed to the conditions in Central America. And my question to you is, with all of these insects and diseases and rodents and such that are migrating north, well, people have lived with this in Brazil for years, centuries, and they hadn't wiped out Brazil. So why is it a problem with these things now moving to Texas? How come we can't ward it off?
Well, there are a number of reasons why. First of all, our medical community is not well versed in diagnosing some of these diseases. So you can walk into a medical clinic or your doctor and he'll just scratch his head and he doesn't know why you have that fever or that rash.
I see.
So that's one reason. The second reason is that we are not adapted to some of these diseases. For example, sickle cell anemia is a human adaptation to malaria, and it actually confers upon people who have sickle cell anemia a reproductive advantage in areas that are deeply infected. The third is that in these areas that have large infestations of these diseases and insects, their mortality rates are higher. They don't live as long. They have higher rates of infant mortality. So yes, they have adapted, but there really is a very deep impact on their society. And there are regions of Africa that are uninhabitable because of the tsetse fly.
What are some of the steps that we as everyday people can try to take to help us avoid getting sick from these things coming north?
There are some really simple ones, although I don't know how convenient people will think they are, but it's something that I certainly do. When you go outside at the time of day when insects are most active, wear a long sleeve shirt and long pants, and wear socks. I mean, it can be that simple. I spray pretty frequently with insecticides that contain either DEET or a DEET alternative like a picaridin or even lemon eucalyptus oil, something which wards off insects and insect bites. Remove any standing water from your property. I mean, believe it or not, even a little tiny pool of standing water will breed mosquitoes. They're incredibly adaptive. And so there are a number of simple things, common sense things that you would do, like if you're going to camping and you didn't want to get bitten by insects, you do the same thing. Well, you just do them more frequently.
So really take the same precautions that you would take if you were going to a place where there's, like for example, I just returned from the Northeast. There's a lot more mosquitoes in the Northeast than there are in the Southwest, so you take steps to protect yourself. But I mean, is it really that simple? I mean, because again, you mentioned that we're being exposed to things that we've not been exposed to before. Short of just staying inside your house, your car, or the mall all day long.
Which of course would make many people quite happy. There's not a lot else you can do except for really work long term to try to minimize the areas that we make friendly to these nasty critters that we're inviting into our home is basically what we're doing. There's not a lot else that you can do that's simple. The one thing that you can think about, though, is modifying your activities during the day. Like, for example, when I barbecue, I don't go out in shorts and no shirt at dusk because I know that's when the mosquitoes are going to be out. Just little simple things like that.
Almost out of time, but I want to give you your soapbox opportunity to talk about, I don't want to say doom and gloom, but what are we looking at happening to us in the next decade or two? Well,
I have to say, without being doom and gloom about it, that the picture is not horribly pretty. We've talked about the migration of diseases moving north and the emergence of new diseases, but there are a number of other consequences. For example, stinging insects like wasps and hornets. They're now found in parts of Alaska that have never been seen before. There are a huge number of allergens that are already increasing. What happens, CO2, the primary greenhouse gas, supercharges the growth of ragweed, which of course the pollen of which causes hay fever. It also supercharges the growth of the trees that produce the most allergenic pollen. I want to come back, though, on that same question about the interconnectedness of the earth that you referenced earlier. There have been severe droughts in Africa. We believe they are partly a result of climate change. How does that affect us? Directly, what happens is you have these huge dust clouds moving across the Atlantic. And what we've seen is a 20-fold increase in asthma in Florida. And you can relate it directly to the airborne particles and particulates that are found in those dust storms coming from Africa. It's all interrelated. And then they're going to, if you want to get away from all that and go down to your basement, you're going to find more mold and fungus because they really grow better in warm, moist environments. So there's a whole host of changes that we're going to be seeing, none of which are particularly pretty.
Amazing information. I think they gave the Nobel Prize to the wrong guy. Jeffrey Schweitzer, again, fascinating information. Thanks for being with us.
Thank you for having me. I really enjoyed it.
Really appreciate it. We'll be back after this break. Stay with us.